orthodontist and implantologist. Today we'll be talking about what is dentistry and what are the various dental treatments. So who is a dentist? A dentist is a person who is qualified to treat diseases and other conditions that affect the teeth and gums, especially the repair and extraction of teeth and insertion of artificial. So the dentist is the person who takes care of oral cavity and its associated structures. There are various or different kinds of dentists who are qualified to take care of different parts of your oral cavity, which we'll come to later. Then there are various dental degrees. Firstly, the dental degrees are classified as undergraduate degree and the postgraduate degree. So the undergraduate degree in India is called the Bachelor of Dental Surgery. In US, it's DDS and DMD, which are Doctor of Dental Surgery and Doctor of Dental Medicine. In Britain and all the other European countries, they have a Bachelor of Dentistry, Bachelor of Dental Science, Bachelor of Degree of Dentistry, and Diploma in Dentistry. And there are postgraduate degrees which are acknowledged across worldwide. In India, it's called the Master of Dental Surgery. In specific fields, there are 8 different fields. So there is a MDS in other fields also. In other countries, some of the colleges have MS, some call it MSD, some have in UK and in other European countries, they have MDent and DClin. And some of the dentists have fellowship of Royal College of Dentists in UK, Canada, etc. So what are the various dental specialities? Then firstly, there is the endodontist, then oral and maxillofacial surgery, orthodontist, prosthodontist, periodontist, and the pediodontist. So what is an endodontist? Endodontist is the branch or the dental specialty which is involved in doing the root canal treatments and doing fillings and taking care of the teeth. Then comes the oral and maxillofacial surgeon. The oral surgeon, this is in this branch, the dentist take care of your maxillofacial structures. What is the maxillofacial structures? Are your maxilla, your eyes, your skin, your mandible in the overall. So they do cancer surgeries, trauma surgeries, as well as your tooth extraction to your implantology. Anything related to the surgical aspect, we go to an oral and maxillofacial surgeon. Then comes the orthodontist. Orthodontist is one guy who will align your teeth properly. So a lot of people, a lot of patients, they are suffering from crooked teeth, malaligned teeth, missing teeth. So they need an orthodontist to get their dental arches into a proper form and shape, after which further rehabilitation should be done. And then comes the prosthodontist. Prosthodontist is one guy, one dental specialty which deals with replacement of from single teeth to multiple teeth, including implants, removable dentures, crowns, bridges, post and veneers. Is the guy to go for, the dental specialty to go for is a prosthodontist. Then comes the periodontist. Periodontist is one guy who takes care of your gums and does gum surgeries, take care of your gingival recession, etc., along with implant management also. Then the pediodontist is the dental specialty dealing with pediatric children. So they do all kinds of dental treatment related to pediatrics, which include pulpectomy, pulpotomy, fluoride application, etc. So as I had told earlier, what were their specialties and what they do? So in small terms, periodontist, kids' teeth, prosthodontist, crown bridges and dentures, periodontist, gum disease, orthodontist, straightening teeth, implantologist, dental implants, and endodontist, root canals, and oral surgeon, extractions. So there are 9 common dental problems everywhere, which include pain, sensitivity, discolored teeth, bleeding gums, missing teeth, broken teeth, crooked smile with crooked teeth, difficulty in mouth opening, bad odor from mouth, and cosmetic reason. These are the most common dental problems for which a patient visits a dentist, and it's the dentist's responsibility to correct all these problems. And there are various different treatments for each of these dental problems. which is on the dentist's discretion and capability of doing the further treatment. So what is endodontics? Root canals. Root canal is a treatment sequence for infected pulp of a tooth, which is intended to result in elimination of infection and the protection of the decontaminated tooth from the future microbial infection. In simple terms, what happens when a tooth suffers from dental caries? There is a lot of infection which involves the pulp. And when the infection involves the pulp, there is a lot of pus and all the others microbial invasion. They cause a lot of pus and pain. So an endodontist uses his armamentarium, especially the endodontic files, and removes these dental pulp, fills and makes the tooth hollow. And after making the tooth hollow, the endodontist places gutta percha or a post and fills the canals of the teeth so that these teeth can be maintained into the oral cavity for a longer duration. Periodontal disease is a gum disease. So gingivitis and periodontitis. Gingivitis means the inflammation of gums. So the teeth are below the teeth, the gums are present. Gums are tissues which get regular blood supply and everything. They are not hard tissue like enamel on the tooth structure. So any kind of inflammation of the gingiva, it's called gingivitis. And then if gingivitis can spread to periodontitis. Periodontitis is a more serious gum disease which involves destruction of the bone, gingiva, and periodontitis leads to loosening of teeth, and sometimes you see patients lose one to multiple teeth because of periodontitis. The gum surgery, when the patient suffers from gingivalization, sometimes what happens due to gingivitis or periodontitis, the gum tissue from its normal position goes down, recedes. So to correct these surgeries, when it goes above, it's called gingivectomy. And when it goes below and you bring it to this correct position, it's called gingivoplasty. Then oral surgery involves extraction, bone grafts, jaw correction. So extraction is removal of teeth. Bone graft, sometimes what happens after extraction or the patient was missing a teeth, the bone in that area becomes deficient. So you place bone grafts to correct that deficiency. Then jaw correction. Sometimes people have a smaller lower jaw or a smaller upper jaw. Then jaw correction surgeries are done to bring them in a proper alignment so that the person looks much more appreciative. Oral surgery also involves repair of cleft lip and cleft palate, and a lot of dental traumas. Oral surgeons take care of dental traumas, which include orbital fracture, maxillary fracture, planned facial fractures, mandibular fractures, condylar fractures, etc. Nowadays, also there are surgeries to reduce the snoring. Also, oral surgeons take care of your TMJ. This is a temporomandibular joint. Also, the oral surgeons are involved in doing the temporomandibular joint surgeries. Then comes the orthodontics, as I had mentioned earlier. They align your teeth properly, and the alignment of teeth can be done by using braces. The braces can be metal or ceramic. The braces can be placed on your facial and buccal surface, or the braces can be placed on the lingual surface. Then there are aligners and Invisalign. These are removable aligners, plastic kind of dental braces, which help you adjust your teeth. So you need a pair around 7-8 aligners to get through a proper alignment of teeth. Then comes the restoration. So restoration can be done on the crown or a bridge. Crown is the restoration which is placed on sometimes on a crooked teeth or ill-formed teeth, or usually the crowns are placed on a root canal treated teeth. Then comes the dental bridges. So if you see one teeth is missing, you take the support from adjacent teeth and form a bridge on both the sides, and then the bridge is formed. Then comes the dentures. The dentures are prosthetic devices which are constructed to replace the missing teeth. So their dentures can be used to replace maxillary teeth and mandibular teeth. Conventional dentures are usually removable. The dentures can be over dentures or implant supported dentures. So there are different kinds of dentures. Then comes the dental implants. Dental implants are titanium screws which are placed into the bone and help in removing the missing teeth or one teeth to multiple teeth to the whole dentition. Then comes dental restoration. So the restoration consists of sealants. Sealants is a plastic coating painted on the teeth. It is just a preventive measure, usually done on kids to prevent to prevent the spread of decay. Fillings are done when the tooth has been already infected or has a chipped or damaged or has some caries infection. So these caries structure and everything is removed and the filling is done using amalgams or composites. Then comes inlays and onlays. The inlays and onlays are a form of indirect restoration in which inlays are placed into the oral cavity, into the tooth structure. So in inlay and onlay, the major difference is inlay, there is less of removal of the tooth structure, onlay, more removal of crown structure, and crowns, there is even more removal of crown structure. That can be inlays always inside the confines of the tooth. Onlay, even sometimes even it does not confine to the tooth, also replaces missing cusps and other tooth structure and the other part of the tooth. Crown completely removes the whole of the crown structure which is present in the oral cavity. Then comes composites and veneers. Composites are materials which are placed on existing tooth. They are used for doing veneers. They are used for doing fillings. They are used for making cosmetic improvements, and they usually take 1 to 2 appointments, which can be used to correct the deformity. Then comes dental veneers. So a lot of people suffer from discolored teeth to malaligned teeth to small teeth to malform to tetracycline staining, etc. So a cosmetic correction is always done using veneers. So veneers are micro thin prostheses which are bonded to the tooth and hence in help in modifying the shape of the tooth, shape and color, etc. And hence improve the cosmetic appearance of the patient. Thank you.